Time for our next community conversation. Now we are joined by Dr. Jason Itri, program leader at the center. Hi there, Steve.
All right, Casey, we talk all the time with folks from the center as they come in about healthy aging. We'll go through physical therapy or mental health and whatnot. This one may be not as easy to talk about for people, but it's important to have intimacy in your life as you age as well.
That's right. So we're doing an educational session on Friday, partnering with Lisa Goldstein from Magnolia Health, who's a certified nurse practitioner. And we have very complementary practices. And what we focus on is healthy aging and intimacy. And if you understand how those two interact and how those two cross, what you see over time as you age is that your body changes. You gain weight, you lose muscle, you lose hair, and that can contribute to your confidence in your relationship with your partner. You can start to think that your partner doesn't find you attractive. You can start to have health issues that affect your ability to be intimate, your ability to have sex and enjoy sex. And that's really what our educational session is focusing on.
And how did you get involved just in this aspect of healthy aging initially, just as a doctor?
That's a great question. That was my personal experience. So I'm actually a trained radiologist. I look at imaging studies. That was most of my career. And when I was in my mid-30s, I have a very beautiful wife, and I realized after a few months that I had no libido, I had no interest. And that's when it kind of clicked, and I realized that my problem was low hormones. And we had a great practitioner in the area where she treated me. And then we realized how much of a benefit it had for both of us. We both do hormone therapy, and that's how we got involved in the practice. I think it helps when you're a provider, when you do it yourself and you understand the benefits and how it makes you feel.
And do you find when you're talking to older people that they're receptive to kind of this advice and suggestions and teachings?
Absolutely. And I think what happens, there's the tragedy side of it where an older person who's got low hormones will go to a physician and say they have low libido, they have low energy, they have brain fog. And the physician says, well, that's a normal part of aging, which it's not. And you can go see a sex therapist. And that's the wrong answer, because really it's low hormones. And so that's what we focus on is supplementing hormones to help people feel and look their best.
So let's talk about this event specifically that you were talking about with the center. Who should attend these?
Anyone who's interested in intimacy and healthy aging. There's a lot of misinformation out there about hormone replacement therapy, specifically for women, generated by studies like the Women's Health Initiative. And the difference really is in the type of hormones that you provide, whether it's bioidentical or synthetic. So we're going to be talking about the data, talking about all the options out there for people, and it'd be great to get people to come and ask some questions.
But remind us again when the programs are and how can people sign up for them?
So the session is going to be this Friday at the center at 1 o'clock. You don't have to be a member, you can just show up, and you can sign up through thecentercville.org.
Much appreciated. I know it's a topic a lot of people will be interested in and appreciate hearing from you on.
Yeah, thank you for your time.
Casey?